Hi, I'm Dr. Charles Denham. Today's briefing is regarding the Med Tac training program, which addresses bystander care and what can be done before professional first responders arrive.
The training initiative is the Medical Tactical Certificate Program, called Med Tac for short. While the leadership team were developing an active shooter program at the Texas Medical Center, they consulted Michael Dorn, an internationally recognized authority on campus safety and author of 19 books on the topic. He expressed his frustration with the lack of awareness of the many more preventable deaths at schools and campuses from other causes. A careful review of the medical literature and consultation of leading medical experts confirmed the staggering number of deaths and harm that can be prevented by non-medical bystanders in those precious minutes before professional first responders arrive. So the MedTac program became an integrated approach to these causes that began with schools, scout groups and their initiatives, and the MD Anderson Cancer Center at Texas Medical Center. The work has expanded to 4 states, including California, Texas, Hawaii, and Florida. With an active R&D program in bystander care methods and innovations, a college and university program first launched at Stanford University, followed by the University of Florida, and production of a feature-length documentary entitled 3 Minutes and Counting. Building on early successful acceptance, specialty programs for lifeguards and the surf community, divers, dive instructors, and rescue divers, commercial aviation for in-flight emergency management, and a corporate program for companies with high-volume public interaction are being developed, such as for the hospitality and fast food industries. The Med Tac team believes that bystander care opportunities exist on every school campus, at every sporting event, and with all public-facing companies. The team includes national medical leaders and educators, simulation program directors, and law enforcement threat experts who have tackled the most frequent, severe, and preventable causes of harm and death to children and adults with one integrated approach. One major component of the program addresses the knowledge and skill training of cardiopulmonary resuscitation with the use of automatic external defibrillators for sudden cardiac arrest. A second major element is the control of major bleeding through the American College of Surgeons Stop the Bleed program, which includes the use of pressure, tourniquets, and wound packing that can save one life every single hour in the U.S. if the public had these competencies. The mission of the MedTac team is to get the right emergency care at the right time, every time. The program is being delivered to schools, scout groups, and faith-based organizations at zero cost. This is accomplished by leveraging technology and leaders on the ground in the communities they serve through 4 major strategies. The laser focus is on the first life-saving minutes before professional first responders arrive. The curriculum is continually updated to mirror the latest accepted evidence-based medicine guidelines and developments. A blended learning approach with a combination of online and on-site training by local trainers allows a flexible approach for students. Immersive simulation techniques using real-life scenarios are used to improve reaction during high-stress crises. This allows learners to fall back on their training and mental muscle memory. The scaling approach is one of building a virtual network of community networks and a team of local teams on the ground. On-site trainers are paid directly for skill training through networks of educators and membership organizations. Given that most communities have trainers who can provide on-site training locally and that the MedTac online content is free, the vision of the MedTac team is that programs will grow with the least possible resistance. They are hopeful that many will join the cause of promoting the proper bystander care in all communities, whether they do it with MedTac or develop a program on their own.